finding the common ground. This might be really hard when someone's reality seems totally different to yours. They're like, you said you hated me and you're the worst and you're a narcissist and you're blah, 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 blah. And you're like, what is happening? None of those things I said. And this person's furious at me for something that I don't think that happened. Like, how can I find common ground here? Instead of, again, polarizing, right? Like, be like, no, you are a problem. You're the problem. Go get treatment. Find something that you can agree on. I really like always going with finding the kernel of truth in what they're saying and what they're feeling. But I often really like, this is from the DBT, my DBT background, but agreeing on the behavior that's problematic. I especially like it when it's a joint behavior, when it's a dynamic. So for example, if you're dealing with someone who's screaming, they're in a rage episode, they're yelling and they're like, you're the problem, and you go back and forth on that. Well, you could find common ground. You could see things completely differently, but you could find common ground that this way of fighting, this way of working to a solution is not okay. That needs to change, right? So you don't have to be like, you should get treatment because you are a problem. You could say, this way we're fighting and screaming at each other right now, that's a problem, right? We can agree that we need to be able to talk to each other and actually hear each other, right? Or, we got to reduce this conflict, or, we got to help you keep that job, or we got to find a way to talk about this that doesn't scare the kids, right? So you can, or even just like, like if I were to look back, on my, when my mom was going through a really hard time with drinking, she really, I mean, I'm sure after watching this, Mom, you're gonna have some words to say. But I think a lot of the time she felt unheard and unseen and unappreciated for who she was. I mean, that's the things that she would say, and felt like she really wanted to be close to people and really wanted to be loved and be close to her family members. But a lot of the drinking and the fighting was pushing them away. So we could agree that the fighting needs to stop, or we could agree that I really want to hear you and appreciate you for who you are, and connect in ways that, like, I know we can, right? So you could agree on that, right? You might disagree on the solution and the path there, right? That person might be like, well, in order for us to stop fighting, you got to get treatment. You might not even agree on the diagnosis, right? You might be like, this person has borderline personality disorder or narcissistic personality disorder, and they're like, no, you do. Right? But and they might not even think that therapy or medication is the path to there. So that's something to really keep in mind, is like, almost like, as you're trying to convince, no, don't try to convince them. As you're trying to talk to someone about getting help, drop the agenda of getting help. Drop the agenda of like, I got to get them into treatment. You let go of the outcome. But let's talk about the problem, right? A lot of people go, I'm not going to be able to be in this relationship unless you get therapy. The other person feels attacked and confused, and, because what they're hearing is, you need to change. You're the problem. You need to change. And that's when I could love you. So instead, focus on the thing you can agree on, the thing that you both want. We agree that we want to reduce this kind of conflict. We agree that we want to talk through these issues without screaming at each other. Now, I might think that therapy would be the best thing for you in order to do that, but you might think something different, right? The solutions might be a little bit different, but you can agree on a good outcome, right? That benefits both of you, right? So find the common ground.